Hello. Shh. Hello. Thank you, everybody. Please come and have a seat. Please come forward. We'd love to have you fill in those seats at the front to have an amazing discussion and interaction with everybody. Is my mic on? Yes, I think it is. Welcome, everybody. My name is Celia Chouquet, and I'm the co-chair for the Climate Health Initiative for Catalyst Now, together with Shiv. We'll talk about that later. Climate change is the biggest healthcare crisis humanity will face. And it's the most personal one. It affects all of us. Actually, our health is the human face of climate change. This week, the WEF published a new report saying that by 2050, we will see 8.5 million deaths from flooding, 6 to 9 million deaths from air pollution, an economic loss due to heat waves of $7.1 trillion, mental health issues due to trauma and general anxiety caused by climate change, as well as the exacerbation of pre-existing conditions and new diseases that will emerge from climate change, are impacting all of us already, right now. The burden is not equal, though. Africa faces 20 times higher mortality rates than Europe or the US. Children under 5, the elderly, people living with disability or pre-existing conditions are heavily impacted. Women face a double impact as the caregivers for these vulnerable populations, but also as one of the most underserved people on the planet when it comes to healthcare. There's hope, though, and we can do a lot to mitigate and avoid these impacts. I am very excited to be sitting here with the people that are making those changes right now. And we would love to talk about what we think could be the biggest opportunity and change maker in this equation, and that is AI and technology. Thank you so much for being here. I would love for each of you to take some time to introduce yourself.
Brief introduction.
Yeah, brief introduction.
Yes, thank you. Hi, thank you for coming, and hello for those of you who are online listening. Many of my collaborators are. My name is Shiv Kumar. I represent an organization called Catalyst Group. We are a social enterprise platform based in India, work in 25 countries. One of our core areas of work has to be climate, not it is climate. And because we worked on health and livelihood, it was a natural and an important move for us because we work with vulnerable populations like fisherfolk, small farmers, sex workers, for us to definitely do something on climate. And we will present something around the climate and health that we have done.
Thank you. My name is Pradeep Kakatil. I lead the Health Innovation Exchange. We are a Geneva-based platform that works with countries in their digital transformation for health. And maybe this is confession time. I came into the climate space as someone I was dragged into it, not so much because I didn't believe in what was happening with climate, but much more because I thought that would be a distraction from health. 1 out of 2 people still don't have access to healthcare, right? But the reason why we now have a huge piece of work on climate is because we found country after country, the health facilities being completely washed out, incapable of responding when there was a need. So that's one of the areas. We'll speak about it, I guess, soon. But thank you for being here and would love to hear more.
Hi, my name is Jeff Ibbotson. I'm the Executive Director of the Global Surgery Foundation based in Geneva. And what we do, I'm a surgeon myself. I've worked on the front lines in low-resource countries for most of my career. And what I've seen is that when there isn't a resilient health system in place for the most vulnerable people, when a crisis happens, whether any crisis, but in particular as climate crises increase, without that resilient health system in place, it's much worse than you can imagine. And so what we do is we try to build up surgical care systems within the district hospital level in particular to make sure that those health systems are resilient so they can respond much better to when a crisis happens. And as we see climate disasters increase more and more, we need to have that resilience in the health system for the most vulnerable, and we'll talk about that a little bit later. Thank you very much.
Hi everyone, Safia Guinea. I lost a bit my voice. It's the fourth day on Davos, so can imagine. So bear with me. It's a pleasure to be on the panel with such a distinguished expert. I have the pleasure of leading a non-profit organization, Women in Tech, in Switzerland, which is mainly about empowering more girls and women to embrace tech, because technology holds a huge promises, and we're going to touch on that. And I'm a health tech leader, so I've worked almost my entire career in healthcare, and especially for the last 4 years in the area of personalized medicine, in the imaging area. We're going to touch also on the promises of especially digital pathology for early diagnostics and for preventing so many of the disease.
Good morning. Good morning? Oh, okay, thank you. I mean, we're going to be talking about AI, but we need to reinforce the human connection in the room, I would say. And being the room, something we should enlarge in the community. My name is Ricardo Late. Very grateful for the invitation. Very happy to be with so many distinguished leaders and friends. My background is as a medical doctor trained in infectious diseases. That was my first life. Then I served 4 terms as a member of parliament in my home country of Portugal. Don't hold that against me. Then I served in local government also as a deputy mayor. And I founded an NGO called the Unite Parliamentarians Network for Global Health, which is a network of current and former members of parliaments, congresses, and senates today in 116 countries that have committed to science-based, evidence-based policy making through this peer-to-peer network. That's my volunteer work. My day job is based in Geneva, neighbors with my friends here, Pradeep and Jeff. I'm the CEO at Health AI, the global agency for responsible artificial intelligence in health. And we are focused on supporting governments as an implementing technical partner to help build the governance and frameworks and systems so that countries can assess and accelerate the validation of AI tools for their health systems. There are so many technologies out there, but they're not being used to scale in health systems. And so we're hoping to be able to contribute to that acceleration moving forward. Happy to get into that. And since you asked me one last note about my academic work, that we've been focusing a lot on digital gamification and the use of AI for legislators to support legislation development and generation, and happy to then dig into that as we move forward.
Thank you. There's so many amazing things we have to talk about, but before we get started, could you maybe by a show of hands tell us which one of you are coming from the social entrepreneur background? Okay. Any finance people in here? Yes. Yes. Previous life. Okay. Industry. AI. Okay. Tech. Okay. Great. Who else am I forgetting that I should be talking about? Government. Yes. Government. Okay. All right. So thank you. So Shiv, I'd love for you to explain a little bit about the amazing job you do with communities in India right now and what you're implementing to increase the community's resilience to climate change-induced health hazards.
Thank you. Thank you, Celia. I think one of the challenges during COVID we saw was that it wasn't anybody's one organization's problem, right? We had to come together very, very quickly. And so we have formed something called as a COVID Action Collab. And the struggle for most governments was to understand where is going to be the next outbreak. And so we came across sewage testing as a method to predict where the outbreak is likely to happen. And our story began there. And so we started working closely with the city, Bangalore city, where I am from. And we were able to give our government a heads up by 7 days, where is the next outbreak going to come from. When COVID subsided, we said, can we use this for other things? Can we use it for Nipah? Can we use it for other predictions? And we did another 11 more. And then we realized that why are we limiting ourselves only to sewage? Why not use the rest of the nature, right? Air, temperature, water. So we set up a methodology to collect all of them. And then we realized that there's so much of fragmentation on surveillance, right? Government does its own surveillance. Insurance companies do their own surveillance. And we realized none of them are collecting data of these nature. They're all in silos again. What's temperature is with the Indian Meteorological Department, right? Not with anybody else. So we thought bringing them all together in a single platform would be ambitious, but with AI, I think potentially possible, not just AI, but other tech too. So we started moving in that direction. And then we had this wonderful opportunity from Philippines. There's a terrific mayor in Tabaco City, and she reached out to us and said, I don't want any of your tech and AI, but I want an answer for a problem I'm facing. I have 0 dose children who have not been immunized ever, the largest number in Philippines, in any city. I want to know why. So we did a bit of modeling with her, and then we realized that it had very clear links to typhoon and the volcanic eruptions. And that's where our journey then started. So we helped her address that issue, and then she said, can I have a more comprehensive approach to it? So really it was the mayor from Tabaco who gently nudged us to where it needs to be used. And it's very important that ultimately the politicians and the policymakers get this information, right? And then we realized there were more silos happening. The health department data was sitting in one place. That was not integrated with this. And the media, what are you searching for? Are you searching for paracetamol in this area? That's very important information. That was sitting in another block. And then what are people's perspectives? What does a street vendor feel about the heat? How are they experiencing it? How is it changing them? In Punjab, one of the states in India, onion farmers have moved to night farming. Right? And because they can't farm during the day because it's so hot, but then snake bites have increased because of that, right? So what we then thought about is that what would be an ideal platform to bring all of this together? And that's where we thought about what is nature telling us, air, water, sewage. What is the media telling us? What are the health systems telling us in terms of admissions and conditions being presented? Including pharmacies. In India, pharmacy play a very, very big role because people first go there to buy medication. And most importantly, what are people telling us? So we set up community observatories within 13 communities, which gave us real-time information. We were able to, because of tech, we were able to get that information quite quickly. Now, setting this up is one part. Bringing them all together, we built what we call as a sense-making engine on top of it. A number of technologies brought together. And therefore, then we were able to do what we call a sense-making out of it to actionable insights. And what do we mean by actionable insights? What should the mayor be doing, right? What should the NGOs be doing? What should the private sector be doing? So we were able to draw that out. And ultimately, we realized something very important. This is collaborative surveillance. This is collaborative early warning system, which is very focused on action. So that's one piece of our work, which is growing now in India and also in Philippines. But the second part of our work is the system has to be ready to do things, right? Jeff, you were talking about hospitals being ready. So when we sat with people at the district level, we realized that, again, there are siloization, people having money, not having money at all, but have to respond to the climate emergencies and the health emergencies. And we saw in COVID, we struggled, right, to respond. So we developed a playbook, which I have a copy here in case any of you would like to take a look at it. There's a physical copy, there's a virtual copy, which I can share with you, where, thank you, Pradeep. Pradeep has been a tremendous supporter of all our work. And we brought in 13 departments and private sector together to really plan out what will a response look like if there's going to be a heat wave, if there's going to be a flooding. And a very important thing, Celia, when you were talking about the changes, we are finding swapping. Districts which used to have heat waves are having flooding, right? And those which had flooding earlier has heat wave, sometimes both together, right? How does the health systems respond? So just to wrap it up, so we worked on the capability building and planning, And in that, the health workers are very, very critical. So we have this Climate Care Champion program, where we work with the Columbia University, building the capacity of the communities and the frontline workers. And this, along with, you have the early warning system, you have a plan, and you have the capability to respond. Only then is this, climate change is a global phenomenon, response has to be local, right? And that's where we are working on this.
Yeah. So thank you so much, and I think it's a perfect segue of how you build it up from the focusing on the community resilience and then going to the healthcare system resilience, which Pradeep, I would love to learn a little bit more about what you have been doing to increase the capacity of hospitals to withstand some of these climate-induced events.
Thank you very much. It's very difficult to follow after what Shiva said because we have had very similar journeys. And you spoke about silos. I think I realized that we need to have been collaborating more because we have done almost exactly the same, but taking a focus on Africa. Because what happens in many of these situations, and again, I said that I came in as a skeptic into the climate and health space. But we discovered that our raison d'etre is basically to scale access to healthcare. Yeah, and then we found hospital after hospital, clinic, everything getting washed away. The supplies would get washed away. So how do you prepare for those situations? How do you help these hospitals to be resilient, both in terms of early warning systems? So what we have done is, for example, we work in several countries in Africa. We're just now setting up in Indonesia also to look at mapping every health facility, and then there's enough climate data that is available on where the floods are going to be, where the droughts are going to be. But as you said, let me take the case of one country that we have worked with in Africa, Central African Republic. Absolutely committed health minister who was losing many of his health facilities to floods, and many of the people were dying because of heat waves. But then we said, okay, have you walked across the corridor to speak to your minister who's responsible for climate, the environment ministry? No, they don't speak to each other. So how do you bring those systems? And then what we also realized was that in many cases, the silos are in our own minds because we said, we need to bring you together, we'll bring you together. But then we got pulled up by the president who said, thank you very much for what you're doing. I really appreciate what you're doing, but you're going to be working on mapping all my health facilities and telling me where the next floods are going to be. We said, yes. Do you think you can do that for our education system? And we were like, yeah, okay, we can do that. Then he said, we have this huge problem with migration because they have a huge number of people who, cattle herders who go from country to country. There's a huge problem. Did you know that the Mpox, Mpox virus that was spreading, it originated in Central African Republic. It's the cattle herders who took it to DRC, which became a huge epidemic, right? So he said, are you able to look at our migrants? So we were the ones who were completely stuck with these silos. So just to say, what we started doing, what we have done now, and what we are doing with countries is we have this, we have been able to use AI, we have been able to use quite a lot of the basic, bringing all this data together. We have now one of the largest databases on health infrastructure, climate data. We have mapped all the hospitals in Africa, and we estimate that 122 million people in Africa will not have access to healthcare because of floods. So we know which hospital. It's not a question of if, it's just a question of when. Within 2 years, we know which facilities will get impacted. So then how do you build resilience? We have been working with several partners on what the future hospitals should look like. How do you build it? One, some of them may need to move from where they are to other places. But in most places, if you really look at it, if you can get a shelf which is just 6 inches above the ground level, you'll be able to save most of the drugs and diagnostics that are getting washed away now. And the last, we are doing quite a lot of using AI for building capacities, amplifying capacities. That's something which we are doing in several countries. But more importantly, what we are finding is that just one more quick show of hands. How many of you are entrepreneurs, social entrepreneurs? Okay. The biggest challenge that I see with the climate and health space, and this is why defining it becomes very important. What we are doing is we are going back to our old models and saying that we need financing to invest in health. It's basically green grabbing, as I call it, from the health sector. I get killed for that by others. But anyway, what we really need is for us to really take a very different approach to the climate and health response. We need to ensure that we are able to engage the entrepreneurs to be able to respond to it. And the role that many of us need to play is to create that ecosystem within which entrepreneurs can plug in. Otherwise, we are going to go back to the same old traditional development model. So that is something which we have been advocating with countries, looking at new financing models, looking at new ways of building those capacities across sectors. I'll pause there. I know that's been too long, but...
No, fantastic. Lots of potential for follow-up there. But also a great segue into Geoff, because you're actually working when the healthcare systems fail, and you've set up funding so that there can be disaster response in those areas where that is needed. So,
yeah, maybe I'll touch on a few things and take a couple of steps backwards. While we sit here during this time, approximately 30 women will die in childbirth in this short hour, and that's without any climate impact. That's just the normal disaster state of most of our world. And so if we want to, at some point, get our health systems ready for a climate effect, we have to deal with it back where it's normal. And that's what we're doing, and we're trying to set up programs where, through our catalytic fund, Surge Fund, to help countries move the needle. Now, you know, what Pradeep shared about how hospitals get washed away, I've been to a lot of these hospitals long, you know, without being washed away. And I sometimes think they should be washed away, because I wouldn't want to go into those hospitals and treat my family, let alone anyone else. And so what we need to do to build resilience is to start where the most vulnerable are. And for us, our passion is women and children. And those are always the most vulnerable of our communities. But then identify those areas where there's high risk. You know, I think of areas like on the coast where they're going to get hit by typhoons, and the whole system disintegrates. The supply chains disintegrate because of these climate-related. We have to do something different before these things happen to build up a system that's functional and working first, so that those 30 women that are going to die in this hour, and even more neonates who are going to die during this hour, aren't dying. And then when the climate disaster hits, they're going to be able to respond different. So there's the issues of infrastructure, with Pradeep you spoke about. There's the issues of integration with the community. And the reality is the lion's share of healthcare gets done at the community level in the district hospitals. We have to link, you know, the FAR community, you know, the village health workers, to the district hospital so that they have a safe place to refer people, and then the system is integrated and starts working. But even with the buildings, the infrastructure there, we need the system, the people inside to actually function. And this is one of the things, I was at the Health AI session, and one of the points I made, you know, I trained as a physician. I shouldn't tell you this because it dates me. 35 years ago is when I started my medical training. The difference in medical knowledge over this 35 years, you can't fit up here anymore. And so what we were talking about is how AI will help that whole process. We are so far behind in our healthcare workforce. We'll never catch up in continents like Africa and areas of Asia. So we have to think outside the box with new ideas, digital technologies and innovations, AI, to bridge that gap. And there's so many elements where we can connect the dots to make a difference. But I'm a strong advocate in saying, okay, let's start and work on the problem before the climate disasters hit. So it's a stronger system in place. And that's when the floods come, when the winds hit, our house won't fall down.
Thank you so much. That is beautiful. And so we went from community to healthcare system to disaster response. And now, Safia, I would love you to explain a little bit what innovation can industry bring to basically leverage and maybe leapfrog some of those holes in the healthcare system.
Thank you, Celia. So I'd like to start before mentioning a bit of my background. Why? Because to what my colleague just mentioned about the death of this woman giving birth, I was born in a village in the mountains in Algeria where there was hardly no facility. So my mom gave birth to many children without any facility. And you can imagine how many women were dying without knowing. And also around me, it was very common to have people dying without any proper diagnostics knowing. So when you're raised with that, right, and you're lucky to grow up in Western Europe, right? I was raised and born. I grown up in Paris and been in Switzerland now for 15 years. And you work in those healthcare company driving innovation. You put things with a different perspective. There was always something in me like saying, how can I actually have impact in those parts of the region? How can I drive the innovation? So I always strongly believe in the potential of technology to really make change happen. So 4 years ago, I started to work in the area of personalized medicine. I didn't know much about it, but I'm from a technology background. And I discovered how many of those features we can find looking at images. So it was in particular area of digital pathology. And I'm not a physician, so I'm not going to start to go into very big details, but I'm more from a science engineer perspective. But you have so many specific features and combining with many of the data sets, so calling it multimodality model, it is amazing how you can find really biomarker that can help to prevent so many of the disease. So for example, in certain disease, you can identify high risk versus the low risk patient, and then identify specific therapies for those patients. So to me, what maybe we are missing in those parts of the world, especially in Switzerland, being the most innovative country is one thing. But I think it's such a wealthy country that there's no sense of urgency that we have to push this innovation. So when I see those solutions in diagnostic of certain disease, I'm thinking, how can we really leverage that and bring it? And guess what? In those countries, they don't need us. They have everything. But they just push things really fast because there's the sense of urgency. They're not having this luxury of wealthy country. They need to push things through. So for me, back to the role of healthcare and the potential of those solutions, this is really huge. And I think they have a role to play to accelerate. So instead of trying, we have a lot of use cases, POC, right? Proof of concept. Of course, we know there are regulatory hurdles. We have data challenges. But sometimes when you have this sense of urgency, you can actually push those use cases. Yes, maybe it's not perfect model, but I think because of so many regions in the world where there's no even healthcare professional access to any pathologist, right? Then those solutions can actually triage at least and get those patients really early on to really prevent those major diseases later on. So I was just fascinated by the whole area of imaging solution. I do think we have to bring those solutions, but we need to accelerate this solution.
And that, again, perfect segue to Ricardo. So, Ricardo, what can we do to accelerate regulatory approvals for this amazing technology and solutions and bring it to where it is needed?
Well, first of all, maybe to reflect upon what we heard here, right? And the common denominator is that when health fails, when we become sick, those that have resources will always find a way to survive. And those that don't are the ones that are going to pay the price of the collapsing health systems around the world. Health systems are going to collapse if we continue on the trajectory, not just in poor countries, in high-income countries too, because the way we've designed health systems are reactive to disease. when we feel something, when we feel the need to go to a physician, it's too late. We have failed as a scientific community. We have failed as a community at large. Because we have to redesign the way we deliver health and care to be focused on well-being, on health, on prevention, so that we can lower dramatically the burden of disease. What will continue to happen is a rise of burden of disease with a rise of costs, leading to a situation of non-sustainability. So I believe that transformative technologies like AI can contribute to that transformation. However, I was saying the other day, being at a global agency, I have the opportunity to meet with many stakeholders around the world, from governments to developers to patient organizations to entrepreneurs. And when many of them come up to us, they say, we want to use AI for health. And I say, why? And most of the time they just say, oh, my boss is saying we have to do something with AI, or, or if you're in government, the minister now thinks AI is the thing to do. And, if you go down this promenade, you feel it, right? It's AI being pushed everywhere. And that's the wrong approach. What you need is leadership that knows where they want to go, and the technology will get you there. So knowing what you want to do, what's your end game, and then building back so that you can use these technologies to design the pathway to get to that end game, which should be lowering the burden of disease, improving health and well-being, looking at longevity, not as just making sure that people live longer, but actually live with quality of life. Living needs to be more than surviving. And this is something that high-income countries in Europe, Japan, with the aging population, they're feeling it now. Africa is the youngest population in the world. But, as we see the expansion of sexual reproductive rights and access to technologies, 30, 40, 50 years from now, Africa is going to be confronted with this factor without the wealth that we have in other parts of the world. And we have to prepare for that. And what are we seeing is many times investments in redesigning health systems in low and middle income countries using the broken disease model of the global north. Seeing huge hospitals being built, and one person has to ask themselves, who's going to work here? All the healthcare workers are leaving, are fleeing. The health workforce shortage is going to continue to grow. And with the impact of climate, the necessities of the population are also going to grow if we don't start mitigating quickly. And so using technology to address that challenge, to ensure that we're getting access to health and care where today we can't, is critical. The issue is, when it comes to AI and health, is that we've identified a barrier. Today, when we did a survey with multiple stakeholders, and it's interesting, both private and public sector, the most common word we heard regarding why aren't we going faster regarding AI and health was the word fear in the field of health. The different stakeholders are fearful of the potential negative impact of not understanding the technology and then being legally liable towards something that goes wrong, reputational risks. And so we need to eliminate that risk factor. I normally give the example as a physician when I prescribe an antibiotic, for example. I'm not concerned about the safety necessarily because I know there was a regulatory agency that did that for me. I'm concerned, is this the best treatment for the patient in front of me? When it comes to AI, many physicians, many ministers of health, many insurance companies are afraid to use the technology because they don't trust it yet. And so what we're doing is working with governments precisely to help build the governance models to assess and validate those technologies so that we can build that trust into the system, and connecting the different government regulators so that we have a global network of regulators, but also a global early warning system. What we mean by this is that we will be able to, as regulators detect potential risks or harm related to the technology, we will be able to identify that and share that information in real time to all of the governments around the world in real time using a red flag system. This is important, this post-market surveillance part, especially as we're moving towards the use of Gen AI in the field of health, so that we can detect problems that inevitably will happen before they reach a scale that they can undermine, once again, the trust towards the technologies. And so we have a huge opportunity, transformative technologies that can help us redesign and reshape many sectors of the economy, including health, that can make us better prepared and more resilient for the future. But we need leadership that understands this, and we need the governance structures to make sure that we can adopt and accelerate to scale these technologies. We cannot continue with the pilotitis that we're seeing, which are a whole bunch of pilot projects around the world, but then there's not the courage or the frameworks to actually take it to the systemic level where we need it. I think the opportunity is here. The fact that AI is center to the discussion at the World Economic Forum brings me hope that potentially we can move in that direction.
Thank you so much. And actually, so that would be one of the questions I like to ask to all of you here at the panel. What do you see, from your perspectives, the next most critical step we need to make to avoid these bleak consequences that are already happening, and if we don't address them, we'll just extrapolate? But then also, what gives you hope from that perspective?
All right. I think technology definitely gives us hope, but it has to be used appropriately. And thanks for flagging it so well. And the red flag system, oh boy, that's what we need. But I'm also finding very interesting. How many of you know survival analysis? Have you heard of it? It's a technique which credit card companies use to predict who will not pay next. And we use that to predict who will not come to the clinic next. So there's a lot of applied tech which is there in the industry, which we can actually bring to healthcare. And there's another one called a recommender system, which many of the online buying sites use. We brought it to looking at who will buy a cooling product. So I'm very hopeful that technology, if you use it well, and with the red flag systems like what you spoke about, Ricardo, and the guardrails are there, I think not only will AI make us smarter, but also kinder. What I am fearful of is putting the cart before the horse. Ricardo, again, I'll pick on the point that you made, is not to treat AI or technology as the solution, but actually as an enabler and an accelerator. Unfortunately, there's a big problem. There is a bounded rationality here. There are bureaucrats that I talk to who don't know what they want and who do not understand the technology well. I don't blame them at all, but then they are forced to make decisions relating to it, right? And that's the scary part. And I think...
So there's education needed, to your point, a lot also. Well, in the entire ecosystem, that's what I heard, but also on the regulatory and policy side, which we are maybe forgetting about. So, Pradeep, what gives you hope, and where do you see big potential?
What gives me hope, I think healthcare to a large extent is going to be taken out of the hands of the doctors here and be put into the hands of engineers, right? And the reason I'm saying that, no offense meant, but fundamentally, doctors are trained to look at the individual, to look at disease, as you said, whereas engineers are taught to think scale and systems. If we want to reach people, I mean, it's completely unacceptable. I mean, talking about life expectancy, which you said, in this country, it's 86, 87, depending on where you are, whether you're male, female. I was sitting next to the minister from Sierra Leone, 51, 35 years, okay? And we still say that is acceptable. So scale, engineers are here, so that's number one. Number two, for me, the fear that I have about AI is that if it ends up becoming the large-scale entities that take over, then the divide is going to be so much more because several countries will not have it. But my hope there is that it goes back to what you said about the trust in the community. I mean, if it was purely intelligence that was going to solve the problems of the world, we would have solved the problems centuries ago, right? I think and this is where I really believe that an entrepreneurial approach to AI and health is so critical, that it needs to be localized solutions. It needs to be something that is grounded in the local reality rather than what ChatGPT thinks is right for you. So that's leveraging that local ecosystem rather than leaving it to the big boys. That's both the opportunity as well as a danger.
Jeff, what's your
My hope,
wisdom?
my hope, and what I've seen is in people, partnerships and people. And what we're seeing is when you bring all the different people together, you have a difference. We've got programming in maternal health where it's not just about talking to the surgeon. It's about talking with the team, the anesthesiologists, the nurses, the midwives out in the community, the med tech assistants who are sterilizing the equipment. When we bring them all together, then we see results. And in the system of people, we're seeing 30% reduction in mortality of women, 40% reduction of neonatal mortality. And so we need to ground it, and it goes back to what Ricardo was saying. You know, we need to ground it in humanity and not put the cart before the horse. These technologies are tools to accelerate and augment what people do. So my hope is in partnerships and people, and that's what will take us forward. And I see this happening more and more, you know, bringing in social entrepreneurs, bringing in private industry. You know, we never used to talk to private industry. It was taboo. We need to have all of these people together because we all learn from each other. Venture capital, all these different avenues to make a difference. So that's what gives me hope moving forward.
Yeah, we need the ecosystem. And I think we need the ecosystem to focus on those specific outcomes. So I love what you just said in the reduction of maternal health death, because that is very concrete. And as an ecosystem, we can get everybody aligned behind that to work towards those numbers.
Yeah, and I just have to say, I mean, we've all been here in Davos, and we're here, you know, we hear all this talk about what we should do, what we want to do. But I'm encouraged to hear what we are doing, you know, and the impact that we are seeing. And this is, to be quite honest, I'm honored to be part of this panel because here we have a bunch of people who are actually showing impact and making a difference, not just talking about it. So it's a privilege to be with you guys. So,
Safia?
Building on that, I'm also happy. I mean, I'm the woman here with Celia. You can imagine that there's not as many women as we would like to see in those panels. And that's why we advocate so much. And I think you touched on that, diversity, not just from the gender perspective, but that's one of the biggest one. Let's face it, when you see all those discussion where key decision makers are most of the time the men. And it's nothing against our male colleagues, but we need different perspectives. And when you observe a cross-functional team without enough diversity, even, you know, background, ethnicity, you name it, right? Then I think you're not really tapping into all the opportunities and you're not looking at all the risk. So I think for me, that's one of the major elements that we should not neglect. Hope, for sure, I have hope because I do think technology holds the promise. You also touched on that. Nothing far from replacing our physician for sure, but rather to support them because we are desperately lacking them. So to accelerate and to make sure they focus on more the cases we need to focus on. And lastly, I would like to also bring a watch out is linked to diversity. We need to make sure the solution we are working on, involving technology, are inclusive. And we know it's difficult to find the right data. So
and are developed by women because they're actually the majority of the healthcare frontline workers. So
exactly, Celia.
90%, right? You have 30 seconds to wrap this up.
Okay.
I know you can do it.
I was going to say more, but well, can I do? Well, just very quickly, two anecdotes. So you guys know Dr. House, right? The famous TV doctor. He had a patient who had asthma, and we know that asthma, chronic obstructive pulmonary disease, is rising tremendously due to environmental factors, and the patient had seen 5 specialists in the last few months, getting worse and worse. And he said, "So what are you doing?" She's, I'm doing one of those inhalers, right? And he said, "How many times per day?" 4 times per day. He says, "It's impossible that you're not getting better." Then he looked at her and he said, "Show me how you use it." And she got the inhaler and she used it like perfume, right? and so there was a study in Portugal, my home country, that showed that 60% of the patients did not understand the instructions for follow-up that the doctors told them. And I've been in that, that doctor's office where patients are saying, yes, of course, I'll do that, absolutely. 60% had no idea what to do next. I'm hopeful because we are moving towards a world where people will not be alone anymore, be it in this symbiotic world between humans and machines, if we're able to do that. And what we also need is to make sure that we align the financial incentives in the system. Because right now we are incentivizing disease. If we are able to incentivize health and well-being, things like compassion, as you were saying, Shiv, will come at the top priority. Because we have seen, there's a book called Compassionomics that I highly recommend that shows that putting compassion in a measurable way within health systems actually improves health outcomes. So we're actually capable of measuring and creating financial incentives. Just to end then, be careful then how you design the incentives. Because I was having a Zoom call the other day with a colleague in Southeast Asia, and he had his cell phone on a swing on his desk going back and forth, back and forth. I said, why? I mean, I was distracted, and I said, why do you have your phone there? Sorry. And he said, oh, it's because my insurance company gives me a premium if I do 10,000 steps a day. And so we just have to be careful how we do it.
Thank you so much.
I give my daughter.
Yeah, thank you so much for this amazing panel. And I know, Pradeep, you will have to scoot out. Maybe can I have another one or two questions from the audience, and we'll let you go, Pradeep. Thank you so much.
Thank you so much. Sorry for running.
Hi. Firstly, thank you so much for the fascinating discussions. My name is Ali. I represent Meri Sehat. We are Pakistan's fastest growing AI-enabled healthcare platform. What I've noticed from a developing country is that the AI is the Trojan horse for allowing governments to kind of rethink the entire healthcare system. And my question is to Ricardo. Policy itself is usually seen as a risk aversion kind of governance framework. How do we balance that for developing countries which are both tackling a lack of meaningful policy in many aspects and also require urgent band-aid solutions right now?
Well, you're to the point of what is needed. In many low and middle income countries, and I've been meeting with many of them across the globe, many times there's zero to none capacity when it comes to policy, to regulation, people who even understand the technology in ministries of health, right? So, and it's interesting because sometimes I'm having this conversation with people that are more US-centric or European-centric. They said, no, there's no need to address policy or regulation. It'll actually hold back innovation because they're thinking of the US FDA and the European medicines agencies and so forth, but they forget that more than half of the world probably has zero to none capacity when it comes to these issues. And if we want to address it, we need to build that capacity. And governments that are interested in having that transformative, and I'm happy to hear what you're saying because we need that leadership to want to transform the health system and understand that technology can help. And organizations like Health AI, as the global agency, we are supporting governments in building that regulatory and governance capacity, not to hold back innovation, but to accelerate it on the development side, but also in terms of accelerating the adoption, because we have to make sure that we're adopting it and adopting technology that is useful. Because we saw a Nature study published last year. It was looking at imaging technology that was approved by the US FDA with high sensitivity and specificity. As soon as they took that imaging technology to a different context, the quality of the technology dropped dramatically. We're not talking about vaccines or molecules here. AI demands a localized approach. We need to make sure that the training is done in a way that is adapted to the local reality, which means that we need to empower local leaders and local institutions to be capable of following the speed of the technology, which is a major task, but is one that is fundamental if we want to make sure that AI is capable of doing the transformation you mentioned.
Thank you. You have another question?
Hi, my name is Dr. Royston Vlood. Sorry about the voice. We're working with the Rotary Club worldwide. We're working with Mayo Clinic. We're working with many of the organizations. We know that state of mind now influences up to 40% of outcomes. We know that AI has been fundamentally processed and tasked. And the new beginnings about using emotional and spiritual intelligence. So how do we create what's now, we heard of AI Gen, now it's AI morphic, this neuromorphic AI, which takes into account the whole human being. How are you stepping forward into that agenda? There's technologies out there which are very interesting, but they're not seeing the light of the day. We're paralyzed by mindsets. We're paralyzed by institutions just looking at the money flow. But you can have all of that. $1 spent in prevention is equivalent to $36 spent in cure.
So this goes to your point of well-being and actually turning the system around, I think, for well-being and
Sorry.
Can I just quickly say, because there's another aspect that I think brings some hope to this conversation that reflects what you were saying, which is the fact that one of the reasons we've failed in health in general until now is the fact that we haven't listened to the patient. We've designed systems based on the perception of politicians and of healthcare professionals, but at the end of the day, we are serving the citizen, and what is best for the citizen is not necessarily what is taken into account, nor are the incentives designed to get us there. And so I have some hope because I do see a lot of technologists, engineers and others that understand that we have to take that angle. And so if we're able to do that, potentially we can start to create a community movement and a sentiment that the community needs to speak up more and more. And coming from the policy side, as with Unite and a former member of parliament, I can tell you, if you have the constituents calling for something, the politicians will follow. The problem is many times the voice of the community is not there and they don't feel the support. And so other priorities, many times economically driven, are put higher on the agenda. It's our responsibility as a collective community also to step up.
Yeah, and to the point of we made earlier on entrepreneurship, I think that entrepreneurship should come out of the community, should be community solutions that bring this wellness aspect, and especially patient innovators, because they're placed the best to know what innovation it needs to manage their state. One more? One more question, and then yes, we're really out of time.
Hi, everyone. This is Adi. I'm Senior Cloud and AI Advisor for CXForce. And first of all, thank you so much for thought leadership and insights. So I would like to ask one thing here. While we are driving the value with the tech, how are you making sure the technology is being met with ESG?
Who wants to take that one?
Maybe I can just say if we can connect the dots between the two to make sure that there's some social impact and that it feeds back into a social impact measure, like for instance what we're doing with our catalytic fund surge fund to drive systems forward to reduce maternal mortality. That's like, you can't do much better than saying we've reduced 30% maternal mortality, or you look at how we can leverage technologies to do better diagnoses with breast cancer. That we need to connect that positive loop to make sure that it's getting back in there. We're exploring how to do that.
Thank you so much. The question here is like, when you use AI and cloud, you're going to spend a lot of money. And with the systems, resources, it is creating the carbon footprint, right? And you have to use the cloud and AI responsibly, point number one. The other one is the cyber security, how you are balancing this.
Yeah, and I totally agree. And also I think we should not forget that the healthcare industry has a huge carbon footprint, right? So it actually sort of compounds those two.
Yeah, I know we're out of time. I see the pressure there. But to say that when we talk about building governance capabilities at the government level, the issues of cybersecurity, the issue of sustainability, also from, if you think about 10% of world energy is already being consumed directly or indirectly for AI, we need to make sure that the sustainability component is part of that validation of technologies that we use in our systems. And having regulators as gateways in terms of access to health systems particularly, it's important that that is factored in. And so that's part of the work that we are leading precisely through the global agency.
Can I take 5 seconds?
5 seconds.
The impact of the health system on climate and the climate, the people's impact on the health system are all circular. And therefore, any kind of solution that you bring in, you will need to be aware that you are probably, every solution is also having other sides to it, and you'll have to mitigate for it.
So with that, thank you so much for this great panel, and thank you so much for the fantastic interaction.